Are you getting enough out of your data? Well, the answer might be to let more people see it. On this episode of the eClinicalWorks podcast, we talk with one practice that's found that caring is sharing data, which has helped them to improve engagement among both staff and patients while opening new opportunities for success. Today, we're welcoming back David Uptagrafft, CFO and Director of Healthcare Experience at Innova Primary Care, a 9-provider primary care practice in Huntsville, Alabama. David, how are you today?
I'm well, Adam. It's good to speak with you again.
Good to see you again as well. Now, you've recently joined an ACO with both upside and downside risk after demonstrating, I believe, 3 straight years of shared savings in your previous ACO. How did you get to this point?
Well, it's a journey always, of course, and we've learned a lot over the process. So yes, we were successful in our first 3 years. We're currently wrapping up that model, and for next year, we are shifting into a downside risk model. That actually we completed one term with an ACO. We were approached by a different ACO based on our data that was actually out there on the Medicare sites, which again refers back into our internal process improvement, getting more AWVs done, handling more TCM visits, having high quality risk coding. And as a result of our performance, we've actually kind of leapfrogged ahead into the enhanced track for 2022, which is our first time to be in a downside risk bearing ACO model. But we're actually happy about that because there are other aspects of that model that allow us to outperform the traditional track that we're in currently.
So people are actually paying attention to those measures that are out there, and they are, I believe, seeking you out to participate. Is that correct?
It is, and it's actually incredibly rewarding. We've been pushing for years for this data matters, quality matters, and yet frequently it feels like no one's paying attention. Is the patient even aware of what we're doing here? And so when you're actually sought out and selected based on that effort and the data that's out there, it's very affirming in the approach that we've taken the last few years.
Now, it sounds like your performance puts you in an advantageous position, but quality measures are really only one factor to success here in the value-based model. So what items are you tracking, and how have you managed to operationalize them and support your mission?
Certainly. Well, we are a primary care patient-centered medical home. And so we believe strongly in the concept of it being a team-based approach to primary care here. We have 3 physicians and 6 nurse practitioners, but that's not the entirety of the patient experience, obviously. It starts with the guest experience coordinator there at the front desk, the telephone guest experience coordinator on the phone. And so we have metrics for all these different positions. Some examples are live answered phone call percentage, net promoter score. We do blood pressure tracking using the population health module that's actually at a per provider level, which provides some accountability to those staff members. CCM claims per month, wait time in the lobby. Again, these are metrics that are coming out of EBO or population health reports within eClinicalWorks. Taking that data and publishing it internally to our staff weekly gives them accountability, and it also kind of shifts into a work as play type methodology of, hey, now there was something we're shooting for here. It's not just another day on the phones. It's last week I hit 81% live answered calls. Let's see if I can get 85% this week.
So you are taking that information that you're gathering with the reporting capabilities that are available within eClinicalWorks, and you are sharing them with your staff so that everybody knows where your focus is in terms of your performance improvement. How are you making sure that everybody's aware of those metrics on a regular basis?
Good question. If it's not visible, nobody's going to pay any attention to it. We could send out emails all week long, and you know how that goes with emails blasted out to a large group. So we actually have 2 different team displays here in our offstage area at Innova that are plugged into a rotating slideshow that displays these slides. It's about 5 slides with those key data dashboards. They're either green, yellow, or red, depending on how close we were to meeting our target the prior week. And those are updated every Monday when we repull the reports and republish those. It looks fancy, but frankly, it's just a monitor with the Chromecast plugged into it, shared to a Google Photos shared album.
Sometimes simple is the best, David. I've Totally agree with that. Now you're tracking things like, your volume of visits, but also your performance on quality measures. And I believe you're also tracking things like your risk adjustment factors for your patients and your populations. A lot of practices, David, are getting this information from their payers or from their IPA, MSO, ACO, some organization that they're participating with. Why not simply use that information instead?
Well, that data is useful, but it's all about timeliness and accountability. And so we're really looking to continually improve our performance. And in order to be continuously improving, we like timely feedback. And the data that flows back to us from Medicare, our payers, commercial payers, man, there's a lag. If we're lucky, it's just 6 months. In other cases, it may be 1+ years that we get that back, versus within the population health module in eClinicalWorks, that data is refreshed weekly. And so when we make adjustments internally, we can republish that data. We can benchmark the different providers. They receive scorecards from us with key performance indicators every month. And we say, hey, we talked to you last month about your risk coding, and we talked to you about your blood pressure control measures, and we made some changes, and here's what it's looking like this month. Not, hey, remember we did that thing 18 months ago? Well, looks like it didn't work. So that's a horrible conversation to have. And we've been trying to do that in the past, and we found the population health module tremendously helps us in not just being accountable, but feeling encouraged in terms of the changes we're making are going to have an impact with the payers once they finally get that data back to us.
So David, looking back at all of these things that you've put into place, this increased transparency and accountability and sharing the information with your providers and staff and your patients, what impact are these efforts having for your patients, your providers, and your staff at Innova?
Well, the game has changed in the last decade with regards to patient compliance and who is accountable for patient compliance. And so it's important that our patients feel valued and that they feel we have a relationship, that we care about them, and that we're demonstrating that in ways that they can perceive so that they, frankly, are more compliant, because that's no longer just the patient's issue, it's our issue. There was a 2014 study in the Annals of Internal Medicine that 1/3 of patients that are prescribed a medication are not going to take it. Well, in 2014, that might have been the patient's issue. Today, it's our issue. It's your issue as a doctor, as a clinic. So by providing things across the team at the front desk, measuring check-in times, measuring live answered phone call times, doing things for the patient, sharing their data, giving them nice robes in the room, small things like that add up to be perceivable things that there is a relational value that we're putting in them. We think they're valuable, and they're more likely to engage in that relationship with us and accept our medical advice and take care of themselves. So there's the patient dynamic where they can perceive the value in the care we have because of these things we're doing. And then there's the team dynamic. And we all know that life can be frustrating at times, but particularly medicine, interacting with primary care patients, maybe you're having a long discussion trying to convince them to take a vaccine or take their blood pressure medication. And you remember the ones that were very frustrating. You don't necessarily remember the wins. And so this data allows us, even if we're making small progress, to expose that and to give the staff a sense of hope and progress. Not just, gosh, it's the same thing every day. Different day, same mess. No, there's progress going on here. We are making a difference in people's lives, and this data helps us to show that. And so that gives us a purpose, it gives us accountability, and it allows us to manage it because we're measuring it.
Well, David, we're very excited to see all of the progress that you're making, all of the impact that you're having for your providers and your patients. You truly are a director of healthcare experience from the front to the back and everywhere in between, David. So please keep innovating, and we'll keep looking out for the successes that you're having. Thank you so much for your time today.
Thanks, Adam.
Now, if you'd like more information on any of the topics that we covered here today, including some of the reporting capabilities that are available in eClinicalWorks to help you keep track of wait times, or HEDIS analytics to track quality measures, HCC module to track risk adjustment factors, you can get more information on my.eClinicalWorks.com. eCW University is also available. And of course, you can always reach out to your strategic account manager for more information. Don't forget to check out our other eClinicalWorks podcast episodes on iTunes, YouTube, and my.eClinicalWorks.com. For the eClinicalWorks podcast, I'm Adam Salati. Thank you for watching.